3 years since the start of the COVID-19 pandemic, and its effects are still being felt, with the World Health Organization pinning down the global crisis for the rise in both anxiety and depressive disorders. Those numbers bearing out in the number of suicides locally. Don't lie, they say, but based on what the police force has compiled on suicides, they're certainly troubling. Armed with those figures, Elizabeth MP Jobeth Coleby-Davis on Thursday disclosed that in 2018, 11 suicides were recorded in the Bahamas. In 2019, 8. A year later, there were 7. And so far this year, another 7.
Of the 11 suicide incidents recorded in 2018, 8 were males and 3 were females.
If we were to look at the percentage of males to females of the 43 reported suicides during the years 2018 to 2022, 35 or 81% involved males.
28 or 65% of the reported suicide incidents occurred on the island of New Providence. 25 or 58% of the suicide incidents involved individuals under the age of 50. Females in the reported suicide incidents were under the age of 66, with several leaving behind children. A 13-year-old male was the youngest reported suicide incident. 28 or 65% of the suicide incidents were recorded in the months of March, April, May, September, and December. The month of May reported the highest prevalence of suicide, and of the 39 reported attempted suicide incidents in 2021, 17 or 43% involve individuals within the age range of 18 to 30.
Coleby-Davis, who was contributing to debate on the mental health bill, admitted that she did not always view mental health as a serious national concern for policymakers. But that view changed nearly 10 years ago.
I believe that as policymakers, we have a fundamental obligation to address issues that impact our communities. I also believe that we must be guided by the data that has been collected by government agencies and credible civic organizations.
The mental health bill has been touted as instrumental to ending the stigma of mental illness and tackling some of the reasons behind the problem.